Well, a brand new poll out today had a new round of bad news for the president's health care law. Nearly 4 out of 5 people whose private or employer-provided insurance is changing say they believe it is changing for the worse because of ObamaCare. Jonathan Gruber is a key architect of ObamaCare and an economics professor at MIT. So thanks for that, John. I mean, that's the public perception right now. Is it reality?
Look, Megan, every year since we've started recording healthcare costs have gone up. Employer health insurance spending's been going up. Deductibles have doubled over the last 7 or 8 years. The reality is health insurance in America is getting less generous, and that's why we need Obamacare to protect individuals who are suffering from insurance that's getting more and more expensive every year.
You know that the public doesn't believe that right now. This poll that we're going through, this AP GFK poll, says, do you believe your premium's going up? And do you believe your premium is going up? Yes, 69%. Do you believe that your deductible, your co-payments are going up? 59% say yes. And then, do you believe your plan is expanding to cover more types of medical care? Only 21% say yes. And the people who, cite these downsides all are saying, not all of them, but the vast majority are saying, and we believe it's due to Obamacare.
Well, in that case, they're just wrong. I mean, look, these things, we're just seeing a trend that's been going on for years. Indeed, in fact, if you look since Obamacare has been passed, healthcare spending by employers has grown at the slowest rate since we've been recording the data. So, in fact, if anything, since Obamacare, healthcare spending for employer-provided insurance has gone down or grown more slowly. So I think it's just a question of bad press coverage, misleading press coverage that's made people think that trends which are happening otherwise are somehow due to Obamacare.
Well, but some people are coming out and reporting, significant spikes in their premiums and saying when they go on healthcare.gov, they're seeing significant spikes in their premiums and they don't qualify for for a subsidy. So that's, that's not all imaginary, is it?
No, not at all. I mean, when we go to the individual market, this poll was about people with employer insurance, the 80+% of America. That group really is not really affected by the law. When you talk about those with individual insurance, there is a small number of people who are seeing higher rates. There's also a larger number of people, not the website's working, who are going to see lower rates. Overall, the evidence is that most people will see lower rates, but not all. Some will see higher rates.
Let me ask you about that. Because we were talking with Mark Thiessen at the top of the show about some in the individual market, and we put up the numbers on the board. We have a brain room here that crunches the numbers as the reports come in of cancellations, and they put the number at close to 6 million, around 6 million now, who have had canceled policies. Now, it's tough to say exactly how many are still canceled because some insurers did comply with the president's purported fix and sort of called up some portion of that 5.9 million and said, never mind, you're not canceled. We don't know what number did that. But tonight we learned that Aetna has said it's not going to go along with the president's fix, and that's one of the largest insurance companies in the nation. Do you believe that we are looking at a January 1st event where some large portion of the American people, some large portion of that 5.9 million are going to be uninsured when they were insured just a couple of weeks earlier?
I don't think it's going to be a large portion. I think it's going to be some, and I think that's unfortunate. But I think it's going to be a small minority of that group. I think actually a large share of that group is going to get on the website and find they can actually get insurance that's better and or cheaper than they had before. But there will be some, Megan, who are going to struggle, and that is an unfortunate aspect of this website delay. And I know the administration and states are doing everything they can to help those groups.
What do you make of the fact that, Thiessen was talking about how now we're in a situation where the administration is urging insurers to give more time beyond December 31st to pay, and they're encouraging